How to sit correctly with lower back pain, the posture guide nobody gave you. Welcome back to Health Fix Zone. I am Dr. Dan H., and today I want to talk about something you are doing right now. As you watch this video, right now, in this exact moment, you are sitting. And the way you are sitting, the specific position your spine is in, the way your weight is distributed across your hips, the angle of your pelvis, the position of your feet, is either feeding your lower back pain or fighting it. There is no neutral sitting. Every hour you spend seated is either working for your spine or against it. And for most people, most hours, it is working against it. Here is the number that should alarm you. The average person spends between 6 and 10 hours per day sitting. That is 6 to 10 hours of sustained mechanical load on the structures of the lower back. 6 to 10 hours where the position of your spine is either compressing your discs and loading your joints or decompressing them and allowing them to recover, multiplied across every day, every week, every month. The cumulative impact of how you sit on your lower back pain is enormous, arguably more significant than any single exercise, more significant than any single treatment, because while you might exercise for 30 minutes a day, you sit for 6 to 10 hours. The math is not close, and yet almost nobody is ever taught how to sit correctly. Not by their doctor, not by their physiotherapist, not by their employer, not by anyone, until today. Here at Health Fix Zone, Dr. Dan H. is going to give you the complete posture guide that nobody gave you. Exactly what correct sitting looks like, exactly what it does for your spine, exactly what the most common sitting mistakes are doing to your lower back right now, and exactly how to correct every single one of them, starting while you watch this video. By the end of this video, you will never sit the same way again. Let us go. Part 1. What correct sitting actually does to your spine. Before I tell you how to sit correctly, I want to give you the anatomical understanding that makes correct sitting obvious rather than arbitrary. Because when you understand what is happening inside your spine when you sit, the correct position is not something you have to remember. It is something you can feel. The lumbar curve, your spine's most important feature, your lumbar spine, the lower section of your back, has a natural inward curve called the lumbar lordosis. This curve is not decorative, it is structural. It is the architectural feature that allows your spine to bear load efficiently, distributing the weight of your upper body across the discs and joints of the lower back in the most mechanically advantageous way possible. When the lumbar curve is maintained, even slightly, during sitting, the load on the lumbar discs is distributed relatively evenly. The nucleus of each disc, the gel-like center, stays centered. The surrounding annular fibers, the tough outer rings of the disc, are loaded uniformly. The facet joints at the back of each vertebra are in their optimal position. Everything functions as designed. When the lumbar curve is lost, when the lower back rounds and the pelvis tilts backward during sitting, everything changes. The disc load shifts dramatically toward the posterior aspect, the back of the disc. The gel material is pushed toward the back where the nerve roots live. The annular fibers at the back of the disc bear disproportionate stress, creating the microtrauma that accumulates into disc damage over time. The facet joints are pulled apart from their optimal position, creating shearing forces that irritate the joint surfaces, and this is happening right now in millions of people sitting at desks and on sofas in exactly the wrong position, completely unaware of what 6 to 10 hours of that position is doing to their spine every single day. The numbers that should change how you sit forever. Research into spinal loading in different positions has produced numbers that, once you know them, you cannot unknow. Standing upright, your lumbar discs bear approximately 100% of your upper body load. That is the baseline. Sitting upright with lumbar support, approximately 140%. Sitting increases disc load compared to standing, even in a good position, because the pelvis tilts slightly and the lumbar curve reduces. Sitting without lumbar support, slouched, approximately 180 to 200%, nearly double the load of standing. Sitting slouched and leaning forward, over a keyboard, over a phone, up to 275% of standing load. That is nearly 3 times the disc load of standing, generated simply by sitting in the position that most people occupy for most of their working day. Those numbers are not abstract. They are the load your discs are bearing right now if you are sitting in a typical office or home desk position. They are the cumulative stress that, repeated across every working day, produces the disc changes that cause chronic lower back pain and sciatica. Understanding these numbers, really internalizing them, is what makes correct sitting non-negotiable rather than optional. The 4 elements of correct sitting. Correct sitting is not one thing, it is 4 things, working together simultaneously. Get all four right, and your sitting position becomes genuinely supportive of spinal health rather than destructive of it. Element 1, pelvis position. This is the foundation of everything, and it is the element that most people never address because they focus on their upper back and shoulders while completely ignoring what their pelvis is doing. The pelvis is the base of your spine. How the pelvis is oriented determines everything above it: the lumbar curve, the thoracic position, the neck position. Get the pelvis right and the rest of the spine tends to follow. Correct pelvic position during sitting is neutral or very slightly anteriorly tilted. The sitting bones, the ischial tuberosities, are in full contact with the seat. The pelvis is neither rolling backward, which flattens the lumbar curve, nor excessively rolling forward, which creates an exaggerated arch. The practical way to find neutral pelvis is this: sit on the edge of a firm chair. Exaggerate the arch of your lower back as much as possible, tilt the pelvis as far forward as you can, then collapse into the maximum slouch, pelvis rolling as far back as possible. Now find the midpoint between those two extremes. That midpoint, or very slightly in the direction of the arch, is neutral pelvis. That is where you want to be. Element 2, lumbar support. The single most effective intervention for maintaining the lumbar curve during prolonged sitting. The lumbar region of the spine, roughly the area between your lower ribs and your pelvis, needs support during sitting. Without that support, the lumbar curve collapses under the sustained weight of the upper body within minutes, regardless of how committed you are to sitting correctly. A lumbar support cushion placed at the curve of the lower back provides that support passively, without conscious effort, without requiring constant attention to posture. If you do not have a lumbar cushion, a rolled towel placed at the lower back works equally well. The size of the roll should be enough to fill the space between the curve of your lower back and the chair back without pushing you into an excessive arch. Experiment with the thickness until the lower back feels supported and comfortable rather than forced. This one addition, a lumbar support in every chair you regularly use, consistently produces measurable reductions in lower back pain in people who apply it. At Health Fix Zone, it is one of the first things we recommend to anyone spending significant time seated. Element 3, foot and hip position. Both feet flat on the floor, hip width apart, weight distributed evenly between both feet. This sounds simple, and it is, but it is violated constantly, and each violation creates its own specific mechanical problem. Crossing the legs, one of the most common sitting habits, creates a rotational torque through the pelvis and lumbar spine. One hip is elevated, the pelvis tilts, the lumbar spine is pulled into a lateral curve, and this position, maintained for 30, 60, 90 minutes, places asymmetrical load on the discs and facet joints of the lower back that accumulates into the specific one-sided lower back pain that many people experience. Sitting with one foot tucked under the opposite thigh, another extremely common habit, creates a similar pelvic tilt in the opposite direction. Sitting with feet up on a footrest that is too high raises the knees above the hips, tilting the pelvis backward and flattening the lumbar curve, both feet flat on the floor. Hip width apart, knees at or slightly below hip level. This creates the foundation from which correct pelvic position and lumbar curve can be maintained. Element 4, screen and work surface height. Even with perfect pelvis position, lumbar support, and foot placement, the wrong screen or work surface height will pull the entire posture into dysfunction within minutes. If your screen is too low, you bend your neck forward and down to look at it. The head, weighing approximately 10 to 12 pounds, moves forward of the center of gravity. The muscles of the neck and upper back work overtime to support it. The upper back rounds in compensation, the rounding spreads downward to the lower back. If your work surface is too low, your shoulders hunch forward to work on it. Your wrists drop, your upper back rounds. Same downstream consequence for the lower back. Screen height, for most people, should place the top of the monitor at approximately eye level. Work surface height should allow the elbows to rest at approximately 90 degrees with the shoulders relaxed, not elevated, not depressed. The forearms should be roughly parallel to the floor when the hands are on the keyboard. These four elements together, neutral pelvis, lumbar support, correct foot and hip position, and appropriate screen and work surface height, constitute correct sitting. Not one or two of them, all four, simultaneously, consistently. Part 2, the 6 most damaging sitting mistakes and how to fix each one. Now let me go through the 6 most common sitting mistakes I see in the Health Fix Zone community, what each one is doing to your spine, and the exact correction for each. Sitting mistake 1, the posterior pelvic tilt slouch. This is the most common sitting mistake and the most damaging for disc health. What it looks like, the lower back is rounded, the pelvis has rolled backward, the lumbar curve has been completely lost or reversed. The entire spine from the pelvis upward is in a C-curve shape. The head is forward, the shoulders are rounded. What it is doing, as we discussed earlier, this position dramatically increases disc load at the posterior aspect of the lumbar spine. It stretches the posterior annular fibers beyond their optimal range. It compresses the nerve roots. It elongates and strains the posterior spinal ligaments, and it shortens the hip flexors, creating a mechanical imbalance that persists even when you stand up. The fix: lumbar support placed at the lower back, pelvis repositioned to neutral, both sitting bones in full contact with the seat, chin slightly retracted rather than jutting forward. This single correction, from posterior pelvic tilt slouch to neutral pelvis with lumbar support, reduces disc load by approximately 60 to 70%. Sitting mistake 2, perching on the edge, without back support. Some people, aware that slouching is harmful, sit on the very edge of their chair with an exaggerated upright posture and no back contact. This creates a different problem. The muscles of the lower back must work continuously and without rest to maintain that position. Within 10 to 15 minutes, those muscles fatigue. The position collapses. The person ends up in a worse slouch than if they had been using the chair back from the beginning because their muscles are now fatigued on top of the poor position. The fix: sit fully back in the chair with the sitting bones touching the back of the seat and the lumbar support filling the curve of the lower back. The chair back provides passive support that the muscles do not have to generate actively. This allows the muscles to rest while the position is maintained, which is sustainable for prolonged sitting in a way that perching never is. Sitting mistake 3, crossed legs. As discussed in part 1, crossed legs create pelvic rotation that loads the lumbar spine asymmetrically. But there is an additional problem with crossed legs that most people never consider. Crossing the legs compresses the peroneal nerve at the outer knee, the nerve that passes around the head of the fibula. Sustained compression of this nerve for 30 minutes or more can produce numbness and tingling in the outer lower leg and foot that many people mistake for sciatica. The fix: both feet flat on the floor at all times. If crossing the legs feels irresistibly comfortable, it is often because the chair height or work surface height is wrong and the body is compensating. Correct the chair and surface height and the urge to cross the legs frequently resolves. Sitting, mistake 4, head forward posture. For every inch the head moves forward of the center of gravity, the effective load on the cervical spine increases by approximately 10 pounds. The head at 2 inches forward, a common position for anyone looking at a phone or laptop screen, creates an effective load of 30 to 40 pounds on the neck rather than the natural 10 to 12. This does not just cause neck pain. The upper back rounds to compensate for the forward head. The rounding propagates downward through the thoracic spine into the lumbar spine. A forward head posture is one of the consistent upstream drivers of lower back dysfunction, connecting the dots between neck position and lower back pain in a way that most people never expect. The fix: screen height at eye level, chin slightly retracted, not tucked aggressively, but gently pulled back so the ears are above the shoulders rather than in front of them. Thoracic extension exercises to restore the natural upper back curve that forward head posture progressively flattens. Sitting mistake 5, static. Sitting without movement breaks. Even perfect sitting posture, maintained without any movement breaks for 2 or more hours, becomes damaging. The discs of the spine receive their nutrition not from blood supply. Adult discs are largely avascular, but from the fluid exchange that occurs with movement, compression and decompression, load and unload. The pump mechanism of movement drives nutrients into the disc and waste products out. Sustained static sitting, even in a good position, stops this pump. The disc becomes relatively starved of nutrition over prolonged periods of immobility. The surrounding muscles fatigue and begin to develop the trigger points and tightness that produce lower back pain. The sciatic nerve, held in a compressed position by the seated posture, becomes increasingly irritated. The fix: movement breaks every 45 minutes without exception. Stand up, walk for 60 seconds, perform 5 hip circles in each direction, sit back down. This brief interruption of static loading, repeated consistently throughout the day, maintains disc nutrition, prevents muscle fatigue, and gives the sciatic nerve regular periods of decompression. Set a timer. Do not rely on remembering. The timer removes the cognitive burden and makes the habit automatic. Sitting mistake 6, asymmetrical load, always leaning to one side. Many people have a habitual lean, always shifting weight to the right hip or always to the left. It feels natural because it is familiar, But familiarity is not the same as neutral. This habitual asymmetry creates consistently higher disc and joint load on the side you lean toward. It creates muscle imbalances. The muscles on the loaded side chronically overworking, while the muscles on the opposite side weaken through disuse. It creates piriformis tightness on the compressed side, and piriformis tightness means sciatic nerve compression. The fix: conscious and consistent redistribution of weight, both sitting bones in equal contact with the seat. Weight equal across both hips. If you notice yourself leaning, correct it immediately without judgment. Over time, with consistent correction, the neutral position becomes the new habitual position. Part 3, Dr. Dan H's Complete Sitting Protocol. Let me bring everything together into the Complete Health Fix Zone Sitting Protocol, the practical system that translates everything you have learned today into daily habit. Your chair setup. Do this today. Adjust your chair height so that both feet rest flat on the floor with your knees at or slightly below hip level. Place a lumbar support cushion, or a rolled towel at the curve of your lower back. Sit fully back in the chair so the support fills the space between your lower back and the chair back. Adjust your screen to eye level. Adjust your keyboard and mouse so your elbows are at approximately 90 degrees with shoulders relaxed. This setup takes 5 minutes. Do it today. And then replicate it in every chair you regularly use. Your desk chair, your car seat, your home office chair, your sitting posture. Check these 4 things every time you sit down. 1. Are both sitting bones in full contact with the seat? If not, reposition. 2. Is your lower back supported and the lumbar curve maintained? If not, adjust the lumbar support. 3. Are both feet flat on the floor with uncrossed legs? If not, uncross and plant both feet. 4. Is your screen at eye level and your chin in neutral rather than jutting forward? If not, adjust the screen and retract the chin. These 4 checks take approximately 3 seconds. Perform them every time you sit down. Within 2 weeks, they become completely automatic. Your movement protocol: the 45-minute rule. Every 45 minutes, stand up. Walk for 60 seconds minimum. Perform 5 slow hip circles in each direction. Stretch your hip flexors briefly by taking a long step forward and dropping the back knee toward the floor for 10 seconds on each side. Then sit back down and perform the 4 posture checks before resuming work. This routine, the 45-minute movement break, is the single most evidence-supported intervention for preventing the cumulative disc loading and muscle fatigue that drives lower back pain in desk workers. Set a timer on your phone right now before this video ends. 45 minutes, repeating every working day. Your evening decompression: 3 minutes before bed. After a day of sitting, your discs have been under load for hours. Your hip flexors have been shortened. Your piriformis has accumulated tension. Your lower back muscles are fatigued. 3 minutes of targeted decompression before sleep clears that accumulated load and prepares your spine for the overnight recovery period. Child's pose, 30 seconds. Figure 4, piriformis stretch, 30 seconds each side. Trunk rotation, 10 slow repetitions left and right. Knees to chest, 30 seconds, 3 minutes, every evening, between the sitting of your day and the recovery of your night. Here's what I want to leave you with from today's Health Fix Zone video. You spend more time sitting than doing almost anything else. More time sitting than exercising. More time sitting than sleeping in most cases. More time sitting than any other single posture your body occupies. And yet sitting is the thing that almost nobody is taught to do correctly. The information in today's video is not complicated. The 4 elements of correct sitting, the 6 mistakes and their corrections, the chair setup, the posture checks, the 45-minute movement break, the evening decompression, none of this is difficult. All of it is immediately actionable. And the cumulative impact of applying it consistently across the 6 to 10 hours you sit every day on your lower back pain, on your disc health, on your sciatic nerve is profound. Start right now. While you are still watching this video, adjust your position. Both feet flat, weight even, lower back supported, screen at eye level, chin neutral. Feel the difference immediately, because that difference, compounded across every hour of every day, is what transforms a spine that is fighting daily damage into a spine that is receiving daily support. This is Dr. Dan H. from Health Fix Zone. If today's video finally gave you the sitting guide that nobody else gave you, hit the like button right now so more people destroying their backs without knowing it can find this information. Subscribe to Health Fix Zone for weekly videos that give you the practical health knowledge that makes a real difference in your daily life. And drop a comment below. What is the one sitting mistake from today's video that you know you have been making? Tell me honestly. I read every single comment and I want to know where our community is starting from so I can make the content that helps most. Sit correctly, move regularly, give your spine what it needs every single day. And remember, the chair you sit in for 10 hours a day is either your spine's greatest enemy or its greatest ally. Today, you learned how to make it the ally. I will see you in the next one.